Hello, my name is James Dunlop. I am the Deputy Project Manager of the ongoing Stewardship of Antimicrobials by Veterinarians Initiative, or SAVI. I'd like to welcome everyone to today's webinar, hosted by the Canadian Veterinary Medical Association. The focus of the demonstration and discussion is Firstline, which is a handheld app that will serve as a user-friendly platform at point of care for the revised CVMA Guidelines for Veterinary Antimicrobial Use, or AMU. Before we begin, I'd just like to acknowledge the immense and ongoing effort that's currently underway on the part of our veterinary colleagues and their clients in British Columbia in the face of an historic environmental disaster. We are once again reminded of the critical role that the veterinary sector plays in collaboration with producers, the agricultural industry, and government in addressing animal health and welfare challenges that can arise at a moment's notice. As is currently World Antimicrobial Awareness Week, which you may or may not be aware of, the one health challenge that we are discussing today is that of antimicrobial resistance and antimicrobial use, and the efforts to ensure the long-term efficacy of antimicrobials for both humans and animals. We are privileged to have two of our subject matter experts here today that were involved in leading the latest revision of the CVMA Guidelines and who will be providing insight from the perspective of their species groups. Since 2008, the guidelines have served as a decision support resource for veterinarians, veterinary technicians, and veterinary students to obtain the latest information on recommended antimicrobial treatments, as well as pathogen and drug information. Following a demonstration of the Firstline app by Dr. Scott Weiss, I'll be providing a brief summary of some key points prior to a Q&A session where you, the audience, will be able to submit questions and comments to our subject matter experts via the Zoom chat function. This webinar is scheduled for a maximum of 1 hour, depending on the number of questions and the length of discussion. The demo itself probably shouldn't take more than 5 or 10 minutes. The webinar will also be recorded and hosted on the savi.vet website so as to allow individuals who aren't able to be here today to access it. So without further ado, I'd like to pass the torch over to Dr. Scott Weiss, who will be leading the demonstration of the app, as well as Dr. Alison Moore, who will be answering questions from the equine perspective. Dr. Scott Weiss is a veterinary internist and diplomate of the American College of Veterinary Internal Medicine. He's a professor at the Ontario Veterinary College, the University of Guelph. He's a director of the University of Guelph Center for Public Health and Zoonosis and the chief of infection control at the Ontario Veterinary College Teaching Hospital. He's also a member of the Tripartite Global Leaders Group on AMR and is also the runner of the infectious disease website Worms and Germs blog, which is accessible at www.wormsandgermsblog.com. And our other specialist, Dr. Alison Moore, is an equine internal medicine and sports medicine specialist in Ontario. She owned and operated a specialty equine practice for several years before accepting a position with the provincial government in 2014. She's a past president of the Ontario Association of Equine Practitioners and a present member of the OAEP and AAEP Racing Committee, Steering Committee of the North American Association of Racetrack Veterinarians, and co-founder and ex officio member of the Canadian Equine Veterinary Advocacy Alliance. She's invested in assisting equine vets with appropriate antimicrobial use choices and awareness of antimicrobial resistance patterns as co-chair of the Ontario Animal Health Network's Equine Network. And she's also a member of the CAS, or Canadian Animal Health Surveillance System, Equine AMU Surveillance Committee. So I'm going to invite Scott to take things away, and we're in your hands. Thank you.
Great. Well, hopefully you can see my screen with the, let me know if you can't, with the Firstline app. So James, I think we'll go over the details of how to get set up. So I'll assume at this point, once you're looking at it, you'll know how to get started. So what this is designed to see is just straightforward decision support. The focus really is on the guidelines, because you go to the app or you go to the website, you get guidelines, pathogens, and antimicrobials. And it's very intuitive. So on guidelines, you pick your species, you pick your area. So we could say whatever, respiratory, we got canine, we've got respiratory, then we've got a sex selection there. We've got canine infectious respiratory disease complex or kennel cough. And then it goes over, part of it's when not to use antimicrobials. And that's one of the things that's been tried to highlight is situations where we don't need to use them. And then when you need to use them, what to use. So when to treat, kind of the emphasis on not treating these routinely because we don't have to. When you do need to treat, the recommended treatment options, typically stratified. So here's our preferred option, and here's a secondary option. It depends on the disease, on what options are available and how we're tiered. But you can see we've got doxycycline, and you note the color here potentially. So we have green, yellow, and you'll see some red if I show some other ones. This corresponds to a tiering system. And there's not a specific tiering system that adapts really to a 3-level that traffic light system. So this is an adaptation of the Canadian guidelines, considering the WHO guidelines and EMA guidelines and other ones out there. So the green being our lowest tier drugs, are use them empirically whenever we can. Yellow being, it's a higher tier, let's use them only when we have to. And then red being the group that we want to reserve until we absolutely have to use them. And it doesn't mean they aren't recommended for empirical therapy. And some of these you'll see, but we try to steer towards that. So that's just a basic indicator of, okay, if we're trying to choose between two drugs, let's pick green if we can. So doxycycline, and then when you get doxycycline, you can go to the drug and get some more information on general spectrum activities, some of the pharmacokinetic, pharmacodynamic information. And a lot of this stuff is under development. So the guidelines are the most solid component right now. And as a living document, these things should change over time as there's more information there, information about duration, and we can get some more resources. So I mentioned, I guess, the red drugs. I can show an example of that if we go to urinary. So we go to pyelonephritis. So we get our common pathogens, and you can go to the pathogen and get some information about the pathogen, about how it's diagnosed, general information, general epidemiology, and that's still being developed more in depth. But recommended treatment options. This is canine pyelonephritis, and you can see that the drugs are all red. These are all kind of higher tier drugs, but it's a situation where clinically that is the main recommendation. One of the few situations where we use them, you can click on enrofloxacin again and get more information. I think it's going to come up a little bit later, but maybe give you information where this came from. So the information for these guidelines came from various sources. So the ISCAID, the International Society for Companion Animal Infectious Disease guidelines, were the foundation for where we had those. Urinary, respiratory, skin, looking at other guidelines that were out there, and then expert opinion from various people. I see Michelle Evison was on the webinar. Michelle was involved in quality control of these, reviewing them, providing insight. We had a few other people that were doing that. Sorry if anyone else is on there that I've missed. But so we had some other opinions to making sure that we've got guidelines that are consistent with what we're doing. And this should be a live document or a live system, because things change. And one of the problems we have with small animals and a lot of our species is lack of good guidance, a lot of expert-based guidance, not a lot of clinical trial guidance. So as those become available, which we hope will become available in the near future, these can be updated fairly readily. Unlike a paper copy or a book copy, this can be changed in the back end very quickly. So that's probably most of what you need to see. Again, we've got feline, I haven't shown a cat example, but again, highlighting when to use and how to use them. So feline extractions, a little bit of information on them, when to treat, usually not required. So sometimes it's to focus on when not to use the antimicrobial. If you need to use it, there are drug options, there are dosing recommendations in terms of how we use them, alternatives, and then some important considerations for thinking about prophylaxis. When do we actually need to use them? So instead of just saying, well, probably don't need to use them usually, you need to give a little more information saying, okay, here are the circumstances where it's going to be more valuable. So I won't get into more than that, because the easiest way I think to understand the app and the information that's in it is to start playing around, because it is quite intuitive. I guess from my standpoint, I'm certainly interested in hearing people's opinions on the information that's in there, or anything that seems to be out of date, or if there are any errors, because we want to make sure this is up to date. It's pretty well quality controlled. It's based on the CVMA guidelines that are based on some good guidelines, but this should be an evolving field. So hopefully that's enough of a basic intro, and I'll kick it back to you, James.
Thank you, Scott. I appreciate that. And again, the app is fairly intuitive and user-friendly. It was designed with that in mind, so it isn't that difficult to use. But thanks to Scott to showing some of the different screens that are involved. I'm just going to summarize some of the major points around this app. First of all, it's currently accessible to all Canadian veterinarians, veterinary technicians, veterinary students. And I'll explain how to access the app a bit later. But you do not need to be a CVMA member to access the app. That's an important factor, but you do need to be a member of the Canadian veterinary community. It currently includes antimicrobial treatment guidance for 5 species groups. Those 5 are in there. You can see them right now. Beef, companion animals, as we just went over, canine, feline, dairy, equine, and poultry, with 3 other species that are just awaiting final approval. So those should follow in upcoming weeks. There is a webinar tomorrow that's focusing more on the production level side. They have slightly different categories of information, owing to the fact that there's obviously differences in how antimicrobials are used in the production level settings, withdrawal times, that kind of thing. As Scott mentioned, the electronic format allows for updating and revisions on an as-required basis. So if we go back to 2008, the original form of the guidelines, it was a book. A book obviously is out of date as soon as it's published. The nice thing about having electronic resources, we can update it as we go. And what's interesting about it as well is if you go to any page in the app, there's a feedback button at the bottom, which allows you to essentially provide comments to us who are running the app, both at Firstline and at CVMA as well. So if it's a technical issue, you can't see this, or it would be better if it was colored differently, or the order was different, or you have some ideas on how to enhance the app, you can provide that kind of feedback in there. If it's an issue around the content where you don't agree with a recommendation or you don't agree with the treatment guideline, that's the great thing about this is we are subject to debate. We can talk about it. We can make changes as we go. So we definitely believe that this resource is meant to be a living resource, something that is updated not only due to changes in the operating environment, but also due to perhaps differences in discussion that arise between veterinarians and veterinary communities. It can be accessed in both Apple and Android formats. So again, it's designed to be a handheld device app. You can also access it through the web, as Scott had done for his demonstration. But again, the purpose of it, the way it's been optimized is for a handheld device. And so that's probably the best way to access information. Currently, it's available in English only. We are aiming on releasing a French iteration once all of the guidelines have been translated, making sure they're finalized first. And that's one of our commitments going forward as well. As far as downloading the app, it is an app, so it is in the app stores. So if you do go to an app store, you can find the Firstline Clinical Decisions app. One question we've received from people is there a difference between the human Firstline app and the animal Firstline app? There isn't, it's the same app. Basically, you choose your location as CVMA, which essentially is the animal side of the world. The other locations are essentially human health districts and hospitals. And so Firstline has provided guidance for both the human side and the animal side. So what you'll want to do is choose CVMA. You can also click on that link, firstline.org/CVMA, and that will also bring you to the ability to download the device either in Apple or Android format. Again, because of this information is considered sensitive, the CVMA does have a validation step. Essentially, you would enter your CVMA registered email address. Even if you're not a member, you can still get an email address at the CVMA. You may already have one, at which point a one-time password code will be sent to that email address for you to enter into the code. If you don't have a registration with the CVMA, there's a form you can click on, or you can simply send an email to admin@cvma-acvma.org or at 1-800-567-2862. So again, licensed veterinarians in Canada, members, non-members, technicians, and vet students can register their email address. I'm going to give you a little bit of background about the SAVI project, which is essentially the umbrella initiative that's going on, which helped fund the revision for this guidelines. Essentially, the SAVI project is a creation of a sustainable operating model, what we call a national veterinary stewardship system. And it's something that's for veterinarians by veterinarians. So we've engaged veterinarians in all phases of the process, from planning to implementation. And this is for a whole host of reasons that the veterinary community has expressed to us. Ensuring the continued access to antimicrobials is obviously extremely important. Maintaining the social license to operate, proactively addressing potential AMR, AMU trade barriers with key markets, and we're seeing some movement in Europe around key antimicrobials. Developing the evidence base to explore linkages between AMU and AMR. And again, developing a veterinary-oriented program from within, as opposed to something being imposed from without. So the idea is that the veterinary community would have a hand in designing something that helps with antimicrobial stewardship, and that's the purpose of SAVI. And as far as the scope is concerned, there's two sort of sides to the coin, so to speak. The first side being a practical knowledge and guidance component, which obviously these guidelines are part of. And also we're doing a data collection and reporting pilot, essentially collecting AMU AMR data across 3 specific species groups, beef, swine, and poultry, to assess ongoing change. And if you are interested in involving either side of that project, we'd ask you to visit savi.vet, which is our project website. And the project is scheduled to end March 31st, 2023. So we're heading into, before I get into the questions, I just want to acknowledge, obviously, the funding support behind both the Firstline Initiative as well as SAVI. So from the Firstline Initiative perspective, it was provided through the AMR One Health Consortium, which is funded by the Major Innovation Fund of the Ministry of Jobs, Economy and Innovation, Government of Alberta, and with partially matched funding from the Canadian Institutes of Health Research. And so they've been involved on the Firstline side, compiling the information, ensuring that it's accurate, and porting it over into the Firstline app, as well as some of the design and development on that side. And the other half of that is the subject matter expertise, which was essentially provided by the SAVI project and through our sponsors, including the Canadian Agricultural Partnership, the CFIA, who are obviously members of the Government of Canada. So leading the questions off, we invite you to ask questions. I'm going to ask a few just to kick things off, which are sort of the most common questions we get asked about the resource. But I would invite you to, if you do have a question for either of our experts or for me, please include it in the chat and I'd be happy to go through them. So the first question is, I guess this is for Allison more specifically. We heard from Scott in terms of the companion animal side of things, but Allison was involved on the equine sector. And I guess my question for her is, what are some of your experiences specifically with respect to the antimicrobial guidance development within the equine sector? I invite Allison to answer that one for us.
Thanks, James. Well, first off, this was sort of our first availability to have guidelines. So that's been a great experience. And I welcome all of you to provide input, and thanks for attending today. We've started to have some thoughts trickle in, so it's been great. In terms of the equine veterinary industry, I think we have a lot of positive attributes in our equine vets. We do a fair number of culture and sensitivities with respect to or comparison to other livestock groups. We have focused on and embraced local treatments, joint therapies, regional lymphofusions, intrauterine therapies. And generally speaking, our treatments are fairly short duration in terms of antibiotics, but we have areas to improve. And certainly one that's always been there is treating probably the areas that we don't need to use antibiotics, which is in upper respiratory tract viral infections, which is always an issue. There's only so many antibiotics that we have available, and most of those available to equine that we use are off-label use. So I think the guidelines are going to be helpful for those antibiotic choices. And when we developed the guidelines, it was really about making it practical. So you will see some critical use antibiotics available in terms of empirical therapy. I mean, ceftiofur is the most obvious one but really for using it in appropriate circumstances. The guidelines were also created with the Canadian outlook. So there are a number of guidelines out there and have been produced over the years, but we really wanted to focus on what was available in terms of antimicrobials in Canada, what was used in terms of preferences across the country also to give that Canadian perspective. And you'll find in the guidelines in terms of access to AMR issues, there are 3 articles, one from PEI, one from Quebec, and one from Alberta, although some are a little dated, that have provided AMR for those regions that have been included in the guidelines and the references. We don't have a lot of data, so I guess that would have been a bit of a challenge in terms of PK/PD data for treating horses, but that, we've had to deal with that all along. In terms of opportunities, so what really became we've known about it, but what became more obvious is that we don't have a lot of Canadian data on antimicrobial use for equine veterinarians, nor do we have a lot of ongoing data with antimicrobial resistance. CAS is looking at that across Canada, so I hope we will have more information, but I think the antimicrobial resistance is a key piece that will help guide veterinarians as we go along. Although we do have to rectify some submission issues in terms of sample submission, because we often don't know where the samples are coming from in terms of the site of the animal. So all of that information is important as we move forward. Other opportunities that become more and more apparent, I think one is biosecurity infection control. We've always talked about that amongst veterinarians, but I think we're at the point where the industry really needs, the equine industry, so the non-veterinary industry really needs to support this discussion amongst equine producers, because that is one huge area where we can reduce antimicrobial use, is focusing on biosecurity. And I don't think the industry has done as much as they can. And I think we need to take a little bit of the load off veterinarians in that regard. Support for vaccine development. So again, looking at prevention. we have, in terms of respiratory disease being a pretty significant area where we use antimicrobials, we don't have vaccines for rhinitis virus, which is a very common upper respiratory virus that often causes secondary bacterial infection. So if, looking at support for the development of that vaccine or bringing one back from Boehringer would be great. And also looking at more support. We have a lot of case studies in terms of background information horses, but we need a little bit more work on vaccines for Lawsonia. We use the pig vaccine in horses, but we need some more documented evidence around it. The use of the bovine coronavirus vaccine in horses, and also the canine Lyme vaccine, all of which could help reduce the use of antibiotics. And looking at a little bit of a pie in the sky, stall side tests for viruses would be nice, because that would give us a little bit more effective, quicker way to know what we're dealing with. And then also more work on local treatments. I think, again, there has been some work on antimicrobial delivery through aerosols to lungs, but again, I think that's something that we've adopted in the equine industry, a lot more use of aerosolized therapies. And so a little bit more focus on that kind of delivery would be great. And then one of the big problems that we do face too is dosing and estimating weight. And then, you can put 3 vets in front of one horse and they come up with very different weights on that horse. So having a better way to estimate weight would be ideal. But so some of those are the things that we were discussing as we moved along with the guidelines.
Thanks, Allison. I'm just going to go on to the next question. This is sort of, I guess this question is for both of you. I know Scott touched on this a little bit in terms of the development, but who precisely was involved in the development of the guidelines, and what was the process? And I know this because I've sort of oversaw all the guidelines development across all 8 species groups, and each species group did a little bit differently depending on the structure of the sector and who the experts were and where they were. So I was just curious if you could provide a little bit of insight into how the process went along. And I guess I'll start with Scott perhaps, and then Allison.
Yeah, I maybe covered it already, I guess. What we did is we looked at guidelines that were available as the basis. So ISCA guidelines are the most kind of intensively vetted ones, national guidelines from other countries that are starting to get more common. They all kind of relate back to the same sources. There's a lot of sharing of information or pilfering of information. So essentially it was with that, and then identifying areas that we hadn't covered in previous guidelines, dental disease, for example. And with that, it was just basically coming up with, expert opinion that was then vetted through a group of people in across Canada. So I mentioned Michelle Evans was on the call. I think Maureen Anderson was on the call too. I'm not sure if anyone else is. So we put it through various experts for comments to look at, areas we needed to add on to. And that's something we still need to look at over time. As we start adding on new diseases, we start refining the recommendations that are there and start adding on a little more specific information for some of these. But essentially, like most of our veterinary guidelines, they're really heavily focused on expert opinion, which is a major weakness. But, good expert opinion is better than no support at all. And that's kind of the line we take right now. And we're seeing more movement with clinical trials. So I think in the next 5 years, we'll see more information. And that's just going to be an ongoing process where we continue to flag new information. Like you said, people can put in information. So if something's been missed or not updated quickly and someone knows there's a new randomized trial or a new conflicting guideline, then that's information that's really useful to get out.
And Allison?
So we did kind of a similar thing. We looked at the various guidelines that have been produced. They tend to be more either North American or European or Australian. And then looked into sort of what was appropriate across Canada. We had a fairly, a good sized group of specialists across the country that had input, particularly in specific sections. So Scott was provided some valuable input. Ashley Whitehead from University of Calgary also gave a Western Canada perspective as well. Debbie Parsons, who's an internist in Langley, BC, so she's in private practice. Dan Kenny provided some information around ophthalmology. He's at OVC. Tracy Chenier is a theriogenologist that provided info on the repro diseases. Ian Bishop is a board certified in dentistry in Ontario, so he provided some input on around the dentistry sections. We also bounced information off local practitioners. Does this sound practical? Is this reasonable? Is this what you do? And I also ran it very quickly by CVA, which is the Canadian Equine Veterinary Advocacy Alliance. So that group has members from coast to coast, and they didn't receive a whole lot of input. I think it was probably more of a time thing, but that was sort of the way we handled it.
Thank you, Allison. Before I jump into the next sort of pre-planned question, we do have a couple of questions from the audience. I thought I'd jump in right now. The first one is from Michelle. Great work. Well, thank you. Is there a plan to make these accessible outside of Canada, Canadian vets, et cetera? I think that's something we've discussed on a case-by-case basis. So there are, foreign veterinarians who have a login, for example, at the CVMA, and of course they would be able to access that information. I think part of the concern was the concept that perhaps prescription information in the wrong hands could lead to the veterinarians being cut out of the process. It is something we're discussing and trying to address on an ongoing basis. We would like this information to be available to as many people as possible while maintaining that veterinary client relationship. And so we're sort of dealing with it on a case-by-case basis. But if you're a researcher or an academic, we'd certainly consider that as an option. We did have interest from other veterinary groups, including the American Veterinary Association, with respect to what we're doing and whether they could see what we're doing and perhaps even come up with their own version or some combined version. So there's definitely a lot of interest in what we're doing. At this particular current stage, we're focused mainly on the Canadian veterinary community, but if there are opportunities or other stakeholders who want to be involved, we'd encourage you to reach out to us and just explain your case and why you would like that to be accessible to them. The second question is from Alexandra, and the question is, are there plans to include exotic animals in the app, e.g. rabbits, guinea pigs? Yes, I know Firstline has made this, and the University of Calgary, sort of the other half of the collaboration, is very interested in exotic animals, and they've done some preliminary discussions with exotic animal veterinarians. And so one of my questions coming up is, what do you see the future for this app and for the guidelines? And I think one of the two species that have sort of been on the back burner, soon to be perhaps the front burner, is exotic species, and the other one I think is bees, which there was an interest around bees. So we are open to other species groups. That's an obvious extension of what this information can evolve. And so exotic species is certainly something that's under consideration right now.
Yeah, maybe a jump in there. There's been discussion about that. The challenge really for exotic species, well, a couple of challenges. One is there's so many. So really focusing on a couple of the more common ones. The big challenge really is the complete lack of information that's out there for clinical. Like when you get beyond lab-based studies, which don't necessarily apply to a lot of the field situation, it becomes a challenge. And again, like I said before, a good expert opinion is better than no guidance, but coming up with a good expert opinion is really challenging to do it right. So, one approach is just, you grab references and you toss them online. One of the things we see with exotics, though, is there's some references from 40 years ago that are still being used, including some really kind of strange and probably dangerous dosing, like multiple times a day, aminoglycosides. So there really needs to be a lot of quality control put into it. So there's been some review, as you mentioned, coordinated at the University of Calgary, looking at what information is available. And that's kind of the first step to see what we can do. But it's not an easy process, just given the lack of information and the number of species that are involved.
Thanks, Scott. Moving on to the next question. I guess the question is, who can benefit from this information and how? So I guess are there target audiences that you had in mind, or I guess I can open that up to either Scott or Allison if they want to take a stab at it.
Oh, you want me to go?
You go. Go ahead.
Okay. Well, I think it's pretty intuitive that any clinician could use it, right? And I think students as well, technicians. It's a good general educational tool. So there are various ways it can be used. One is, I've got a case in front of me. I don't treat it very often. I want a quick resource. It's a lot easier to pull this out than to go to a book, and it's a lot more accurate than the book that might have been in your truck for the last 25 years. So there's the ability to look things up very quickly, to confirm doses, to confirm durations, to make sure we're using the best treatment regimen. There's also hopefully just that general review, is because a lot of treatment we do is just based on what we do, right? I do this because I did this before and because my boss did this before. And that includes common things like urinary tract infections in dogs, skin disease, wound infections, where we've got some changes and recommendations over the past few years that may not have made it down to everyone. So periodically, we hope people will do is just kind of scan through some of the common things that they do and see, is what I'm doing what's being recommended right now. And that as more of the bug and the drug information gets developed, that's where I think it's another resource. Okay, I'm using this drug or this combination of drugs. Is there anything I need to know or anything I need clients about? So I think it could be used for that specific patient where I really need to know what to do and I'm not sure what to do. Hopefully it's more as well that I want to step back and kind of reevaluate what I do and talk about what we do and just make sure I'm current.
Allison, did you want to chime in on that?
No, I think you pretty well covered everything.
One thing we heard from production level vets, which is a little bit different than the companion animal world, I guess, in some cases, maybe not actually, but just in terms of they have their protocols already. Obviously, if you're a specialty vet, you're dealing with the same species, you're experts. But they did see a value in reviewing the guidelines on an annual basis when they review their protocols, just to see if anything's been changing in the world. You may already be aware, but you may not. So as a reference, even if you are a specialist, it could still provide some value if you're in the process of reviewing your protocols. And I guess the final question I have here, just bringing it up here, is, yeah, I guess, what would you like to see in terms of future iterations of the app? That's really a good question. And we talked about a little bit in terms of maybe more species, but just some ideas that you may have on expanding the app or the guidelines. Maybe Allison first. Oh, no, Scott, you go ahead, Scott. And then Allison.
Okay. Sure. I think one of the things that's interesting, and I use the human version just to look at things. And part of it's me to think about how we treat and what things we should be doing differently. But there's a lot of information beyond just antibiotic regimens in there. And that's one of the things that we focused on is sharing of protocols, infection control issues, things like that. So I think that's the type of thing that's the value added stuff that can be added on over time, is how do we manage these situations. We have good resources for infection control practices that were being developed by different facilities. So it doesn't just have to be on the antibiotic side, because everything that comes into animal health systems relates to antibiotics. It's kind of one of my themes, right? Better health of the animal means better antibiotic use or less antibiotic use. So I think people could think about what other things would relate to this area that might help as a kind of quick resource, or something, as a place to go periodically when I need to know what to do for this type of protocol.
And well, for equine, so there were a couple of things, and one of the things I would like some feedback on as people start to use it is in the resources. Some of the resources are hyperlinked to articles, and with open access articles, it'll become more and more they'll become more available. But I don't know if that's a distraction to the app or not. So that would be something I'd like to hear back. But so future iterations, there's sort of two things that I'd like to see. One is some inclusion of evidence-based alternative therapies. And we adopt those somewhat in equine right now. Again, I think of wound management, one being, hypertonic saline wound dressings, and Manuka honey being another. Those sorts of things I'd like to see incorporated as we go to try and minimize the use of antimicrobials where we can. And then the other is sampling techniques. I think for many vets, they can go along for quite a while without having to necessarily take a sample for culture and sensitivity, and then, or even for treatment. And they might be thinking, okay, how do you do a tracheal aspirate or transtracheal aspirate through the endoscope? And if there was a short video that showed them, I think that would be useful. Or for regional lymph perfusion, having a short video, or doing a low volume uterine lavage. Those types of things, because we want to encourage people to take samples and send them in for culture and sensitivity. But if a stumbling block is actually taking the sample because they haven't done it in forever, then I think having a quick video they can access would be useful.
Thank you. We have another question from the audience from Dr. John Conley. Is there a role to have detailed antibiograms attached to the app for specific species, e.g. companion animals? So I know on the human side, they have antibiogram information. I guess he's asking if that's something that's either feasible or useful on the animal side. Scott, do you know?
Can you hear me there? Sorry, you froze for a sec. Are we good? Nah, my internet just did something weird.
We are good. Yeah.
Okay. I heard you start and then I didn't hear anything else.
Oh, my apologies. Essentially, John Conley was asking about antibiograms and whether there's a role for that in the companion animal species guidance. I know it's on the human side of the app if you have a look, but I guess that's what he's bringing up.
Oh, the question just came through for me too. Yeah, it's a great question. And, you know, theoretically, absolutely. Practically, it's a challenge. And the challenge comes down to the information that we have. So antibiograms that are patient relevant can be really useful. And it comes down to whether they're patient relevant. And, you know, if we culture every animal or a large percentage of animals that present this way, then that's really useful information. If we culture 2% of them, I can tell you for urinary tract infections in the dogs, some data we have from one thing is it's probably less than 5% get cultured. And the ones that get cultured are the ones that have failed treatment. So we're automatically have a huge bias there. Versus you're in a situation where you're culturing every animal or most of them, then it can be very useful. Now, that said, antibiograms can be used in other ways too. They can help us look for issues. So antibiograms help us see, okay, are we starting to see this resistant phenotype? We start to see ESBLs. We start to see carbapenemase producing bugs. It's not really as much as saying, okay, I've got a dog and it's got this disease and here's what they're usually susceptible to. We aren't at that level yet because of the limited culture data that we have. So over time, ideally, if you can get curated information enough, and this is another thing where your informatics systems start to play a role. So even if we only culture, 5 or 10%, but if there's a way to identify the subset of those that are that patient relevant. So I want to get antibiograms from, 100 horses with respiratory disease that haven't seen an antibiotic before, as opposed to every horse with respiratory disease. Then you can start maybe making some decisions there. So this is where the merging of bioinformatics and curating that information might be useful. And there's a question that I can follow up there from John, I guess, what about large vet hospital for hospital specific biograms? And I think that's where it might be more, it comes down to the concept of, is it patient relevant? So, if we culture all our sepsis cases and we get good culture yield, yeah, absolutely. If we culture a subset of them, then not. So, if it's and differentiating those by an animal that develops a problem in hospital versus one that comes in with it. So, I think if the data can be curated enough, there are some situations where it could be used. We just have to be wary of dumping it kind of straight in from a laboratory database and saying, okay, you should or shouldn't use this drug, because we know that that's misleading.
Thanks, Scott. Allison, did you want to weigh in on this question, or offering you the opportunity? No, you're on mute, but I assume you mean no.
Yeah, no, Scott's the expert in that area, so we're good. Perfect.
Okay, so I guess that's all the questions we have currently in our feed. So if you do have a burning question about the app, about the guidelines, or about the SAVI project in general, I'll give you a good 10 seconds to frantically type it out. Otherwise, I'd like to thank everyone for participating today. I encourage you to download the app. If you are a mixed animal vet, you may be interested in the production level webinar tomorrow. We will be going over some of the same information, but Dr. Murray Gillies will be doing it from more of a dairy perspective, and there's obviously different types of information for production level settings. I'd also like to thank our two experts who are here today graciously, Dr. Scott Weiss and Dr. Allison Moore. And if you do have any questions about any guidelines specifically, and it doesn't have to be equine or companion, but in general, any of the guidelines, you can either, again, click on the feedback button in the app itself or email one of the various email addresses that are affiliated with either this project or the app itself. So again, thanks to everyone. I hope you found this useful. I hope you enjoy the app. And again, we're always looking for your feedback and your interest. And if you do have any questions, feel free to forward them along. And I wish everyone a good day, and thanks again to the CVMA for providing us with this webinar. Take care, everyone, and have a nice day.